kind of like that moment when the curtain's about to go on stage.
And you're struck. Ah, there we go. Wait. Ah, beautiful. There we go. Live on Facebook. I think I can only do one at a time, actually. Okay, well, I guess we're live on Facebook. And that's okay. Well, hello, everybody. Richard here. Richard Elliott here. He, they pronouns. I am the Health and Wellness Manager for the Pride Center of Vermont. And today we are going to be having a small little discussion around, let me change the view. We're going to be having a discussion around PrEP. And we're going to throw in some information about HIV treatment as well. Clearly, I am not alone. I have a lovely special guest with me. I enjoy them so much. We had a lovely conversation about Mpox when that popped up a while back. I have Dr. Timothy Leahy from the Infectious Disease Clinic at UVM Medical Center. They're going to give you a quick intro of them and themselves, and then we're going to hop right into it. So, hi, Dr. Leahy. How are you today?
I'm awesome. Thanks for having me today.
No problem. Do you want to give everybody a quick introduction?
Yeah, you bet. I'm Tim Leahy. I'm an infectious diseases doc, and I've lived in Vermont for about 4.5 years now. I came up from Dartmouth, so it wasn't a long trip up, and it's been a wild ride the last few years. But gratitude that Mpox seems like it's easing off, and gratitude that we can get back to seeing each other 3D and let COVID not be such a big cramp on all of our lives. So we're getting through. It's good to see.
Awesome. Thank you for that. So let's jump right into it. As somebody that works in this field, both for myself on the public health end and you on the medical end, explain PrEP for HIV to me as if I did not know what it is.
Okay. Yeah. So we've learned a lot in the last 3-4 decades of HIV. And one of the things we've learned is that we have a lot of different options to help people not contract HIV infection. And we found that no one option is perfect for everybody. Different people have different lives. And so, of course, it makes sense to have different tools to keep different people safer in different ways. And for me, I think the real game changer has been PrEP, pre-exposure prophylaxis, which fascinatingly, we've had for about 15 years now. It was approved by the FDA in 2011, starting initially with a pill that you take once a day that is incredibly effective at preventing people from getting HIV infection. Bless you. You can take this one pill. The most common version is Truvada, once a day. And if you take it really reliably, we think that the chances of getting HIV infection are decreased by more than 95%, which is huge. It can be either used on its own or used in conjunction with other measures, and looks like it's safe in people of all genders, all sorts of sexual practices, and also people who inject drugs. So it's an incredibly helpful thing. But even PrEP with Truvada had some limits. There were some folks that just didn't work out for them. It wasn't safe for their body, or it caused them some side effects. And so what's been lovely in the last decade is to see there be more options for PrEP, from different pills to injectables. And so looking forward to talking about that today, because I think if somebody is concerned about risk of HIV infection, I kind of feel like finally we've got lots of options to help.
Thank you for that. So I heard you mention Truvada. Are there any other? There are other forms of the medication, correct? What are those other forms?
Yeah, so Truvada is the one that was shown first to work, and that one's a really good drug that most people take without much in the way of side effects and without much in the way of sort of other downsides of it. But there's another drug called Descovy it's sort of like a close cousin of Truvada, but it's just a little bit safer for the kidneys. And so folks who have risk of kidney disease can take that instead. It looks like it's just as effective at preventing HIV. The catch, though, is that Descovy is looks like it's not as helpful for people with vaginas as it is for people with penises. It looks like just the ability for it to get into the tissues and get to high enough levels so that the virus gets blocked is just not as good. It's sort of like a quirk of the way the body metabolizes it. And so if if you're a man who has sex with men or a transgender woman, it looks like Descovy works as well as Truvada, but for other people, unfortunately, it's not as great of an option. And also, more recently, we have injectable PrEP, a drug called cabotegravir, and that looks like that works across a lot of different folks. And so, fortunately, we've got sort of a list of different options we can choose from to sort of tailor to that person's identity, that person's lifestyle.
So what I hear that you say Descovy is not necessarily for individuals who have vaginas. So when it comes to Truvada can be used by anyone, correct?
Yeah, it's any gender, any sexual preference, any sexual behavior, and not just for HIV infection acquired through sex. It can be also through the risk of HIV through sharing needles. So that's the one that across the board, whoever you are, if it's otherwise safe for you to take, that's been proven to work.
Okay.
With Descovy, I the physician, I need to sort of say, well, let me make sure that it's really been proven effective in a particular person to make sure that I can promise them that it's worth taking it.
Okay, thank you. So I hear you say that when it comes to Descovy, it's less harmful to your kidneys. What are some other side effects of PrEP medication?
Yeah, so it's a really important question. Like if you're taking a medicine to try to stay safe from something and it's not being used to treat an infection that is already present, you want to make sure that that preventive thing is incredibly safe. It's sort of like, taking a vaccine. You want protection from that thing, but you want it safely. And fortunately, most people who take PrEP say that the side effects of it are pretty minimal and pretty tolerable. It's not uncommon for people when they first start, say, Truvada, to feel a little bit of an upset stomach. It's usually pretty mild, and to feel tired. And that happens mostly in the first, few days, week or so of your body just getting used to taking it. So that most of my patients who take PrEP and have been on it for a little bit kind of feel like, I just got to remember to take this thing, but that's the worst part. But some people will get headaches that are bothersome, or that upset stomach won't go away. So, you always, with every medicine, want to make sure that, what did it do to me and how they're treating me, so I know if it's okay to take. So the other thing we have to do beyond just like how it makes you feel is we have to check labs and make sure that taking the Truvada or whatever PrEP you're on is also treating you safely. Because rarely I've had folks who feel fine on it, but then we check their labs and maybe their kidneys being irritated by it, something like that. So it's sort of, there's a whole schedule of planned checks that we do to make sure you're feeling okay, make sure that your labs look okay, make sure that other infections haven't come up that we should manage. But I'd say the experience of most people is that the worst part of taking PrEP is getting those checks, because after a while their body just gets used to taking the pill.
Okay. So when it comes to your body, say having an adverse reaction to Truvada, or vice versa, or Descovy, are people able to like switch to another medication?
Yeah, so that's one of the nice things about having two different pill versions of PrEP, as well as now an injectable version, that every once in a while, somebody is the unlucky one. They got the short straw, and that Truvada really makes them not feel great. And it doesn't get better in the second week. And so they're like, hey, what about me? And so certainly if they are in a group where Descovy has been shown to be effective, that's a nice trick to be able to do to switch over to that and see if that's just a little bit more tolerable. And also, I've had folks who, for whatever reason, maybe an allergy or something, couldn't take either of the oral PrEP, and so injectable track PrEP is the option now for those folks too. And even then, let's say you're just for whatever reason you can't take one of the pills and you can't take the injectable. There are other things coming, and so I'm hoping one of these days it's sort of like with HIV treatment itself, where there's just lots and lots of options, and I can figure out something.
Okay, awesome. Thank you for that. Now, kind of like touching on HIV treatment as well. Um, there are medications out there like Biktarvy. Can you give a quick explanation of that as well?
Of HIV treatment.
Yeah.
Yeah, so HIV treatment, as many people know, has been a game changer. We knew pretty early on, by the late '80s, that we had some pills that could lessen the burden of HIV. But really, since the mid '90s, we've had lots of medicines that can prolong life and work to keep the virus under control. And the big advance that's happened in the 2000s has been that those regimens have become more numerous so that whoever you are, whatever virus you have, we can figure something out that will be tolerable and will work. And they've become just so much simpler to take so that now most of my patients are on a one pill regimen or maybe a couple pills, and they're taking it without much in the way of side effects, that we can figure out something that not only will work but can give a good quality of life. Yeah, you still have to remember to take it, but it's much easier than it used to be. And that's huge. Now honestly, I've actually sort of lost count of how many different possible regimens there are, 30, something like that.
Yeah.
And so I always, I recall back in the late '90s in particular, where I had patients where we'd have to say, shoot, we can't get you all the way to a fully suppressive regimen. I can't perfectly protect you from infections, or I can't make it perfectly so that you don't transmit HIV because resistance was there or something like that. Now, man, it's been a long time since I haven't been able to offer that to folks who can take the pills.
That's awesome. That's awesome to hear. Um, so with both PrEP and HIV treatment, though there are these pill forms, but in recent years, I would say in the past 3 years, I would say 3 years sounds about right. Uh,
Mhm.
there have been injectable forms of these medications. Can you give a quick word on the injectable forms of the PrEP medication and the HIV treatment medications?
Yeah, that's right. So, along the theme of trying to make it so that we have different options for different people, one of the big, I think, sort of really fortunate fields of investigation in HIV treatment and in prevention and PrEP has been looking to try to find ways to prevent HIV infection that aren't pills. I think some people take their daily HIV medicine regimen or daily PrEP, and there you go. It's not such a big deal. But other people experience difficult side effects, or they just find that having to sit down and take that pill each day is bothersome, and they wish there was some other way. And so, fortunately, the drug companies have been experimenting with things that last a long time in the body. And it's not like the newest idea in the world. So there have been birth control methods that last a long time. There have been mental health medications that can last in the body for a long time. And so, we've had the idea out there for a long time, but finally here it is in the world of HIV. And so, yeah, for the last few years for HIV treatment, we've had long lasting regimens that, excuse me, you can take and work against HIV infection. And then just in the last year, we have one injectable medication called cabotegravir that you can take ultimately every 2 months as pre-exposure prophylaxis. Oh, I'm just going to let my dogs out of the room. I'll be right back.
No problem. We all have that issue, don't
Yeah, it happens. This is Zoom life. So you can take it every 2 months
2 months. So,
for PrEP, and it works actually better than the pills. And so it leaves a lovely choice where some people are sort of like, look, I got it dialed in with the pills. It's working, and so do I need to change? No, works. They work great. There's not a big reason to change, but if either pills were just not an option because of side effects or because of safety, or because taking a pill itself is regularly is really a big obstacle to this. Now we have another option, which is great news, and so we're ramping up doing that just over the last year.
okay. Um, so the injectable has a higher efficacy. Has a higher efficacy. What does that compare to the pill form?
Yeah, so it's really quite an interesting thing, and it fits what we learned in HIV treatment. It turns out that whenever we did head-to-head studies in people with HIV infection, this regimen versus that regimen, whenever the regimen was easier to take and had fewer side effects, it would win. And it makes sense, right? Like if you can take it more often and it doesn't bother you as much, you're going to take it more and it's going to work better for you. And so it also is true that early on in the HIV epidemic, we had to give folks these wild regimens where you got 16 tablets and you have to have like a timer set because you can't remember which one you're taking when, and this one's at 4 p.m. and this one's at 2 a.m. and we keep it straight. Now just having like a one pill once a day just makes it so it's so much easier to take something that works. So the idea behind injectable PrEP is really similar. The idea is instead of needing to remember to take a pill, which for some people is easy and for some people it's impossible, having something that you just every 2 months take and then it's in your body no matter what, just covering you from the HIV is a real step forward. And so when you take a population of people, one of them on the pill, maybe sometimes forgetting, maybe sometimes deciding, gosh, I just want to break from some side effect I'm having, versus another population where they're definitely getting the injection and it's working all the time because you can't forget it's in there.
Yeah.
It turned out that the injectable worked a little bit better. What I actually think is that if you take people who are taking the pill religiously every day, no doubt about it, and you compare them to the folks who are getting the injectable, the efficacy is basically going to be the same. Okay. But for the folks who are having a hard time taking the pill because it's hard to remember sometimes, the injectable definitely going to work because it remembers for you.
Yeah. Okay. Love that. So obviously, when it comes to taking like your HIV medication, your PrEP medication as pills, you're doing that yourself. You're taking your pills yourself. Are the injectables self-administered, or can you go to your local provider and have them do it for you?
That for me is the huge difference in these. Like I feel a little bit like a used car salesman. It's sort of like, yeah, I got the jalopy over here for you. I'll tell you, there's nothing wrong with it at all. And I don't want to be that guy.
Yeah.
But for me, I think that's a huge other difference. So yeah, the pill you got to remember to take it every day, and that can be challenging for some people and not challenging for others. Whereas the injectable, you take it every 2 months and then you're done. It's just taken care of. The other way to flip that, the downside is that the pill, you take it yourself. It's totally under your control. The pharmacy supplies it, and boom, you can take it. And so, anybody who's on HIV regimen can tell you that it's under their control. Whereas with PrEP, with injectable PrEP, you have to come into the doctor's office every 2 months to get it. And for some people, they're like, "Man, I got to see you again." Actually, you don't have to come in and see the physician, but you do need to come into the clinic to get the injection. And so for them, some people that might be a worse inconvenience than having to take the pill. Whereas other people sort of feel like, "What? I got it dialed in. I come in on the second of the month. I get it. Don't have to think about it again for another 2 months." So I think of it as almost a personality test.
Okay.
Also, there are a number of things that clinics used to do that we're learning can be done just as well at home. So like, there are some checks for sexually transmitted infections that clinics do,
Yeah.
but that actually patients can do on their own. You can do a self swab, and that's pretty reliable, and some patients prefer that. I wouldn't be surprised if we get to the place where each person just doing their own injection, just like, plenty of folks with diabetes, they're like, hey, I just do my own shots. I wouldn't be surprised if we get to the place where people can do their own HIV injection for PrEP at home, but we're not quite there yet. That just hasn't been studied well.
Okay, thank you for that. That's something I was always curious about because I know when it comes to like things like HRT, individual administer that themselves. So
That's right.
in my mind, I figured that would like transition, pardon the pun, over to
Yeah.
sorry, over to injectables, but I guess not. Okay,
Not yet. I mean,
not
you
yet.
can imagine like how this works is that the first study is going to be the one where it's like totally perfectly under the scientist's control and they know that that injection's given. So naturally that's going to come out in the clinic. But the natural next wave is like, come on, we all know it's a little bit of a bummer to have to drive into clinic. And so how about studying, having folks do it at home? And so I'm sure that's coming down the pike. And my belief is that that's going to work perfectly fine. If anything, it can work even better because it lowers the inconvenience, which we know is
Yeah,
an obstacle.
yeah. Thank you for that. I actually have a question from community. Um, Are there any medications and or previous medical conditions that can preclude or prevent somebody from being able to take any forms of PrEP or HIV medication?
Yeah, this is a really important question. We knew from um, HIV treatment that interactions can be a bummer. And so, fortunately, the drugs that we use for PrEP are not the HIV medicines like protease inhibitors that just interact with everything.
Mhm.
And so, in most cases, PrEP doesn't get in the way of medicines people are taking. But there are, a couple of exceptions to that are important to talk with physicians, and it honestly really sort of depends on whether it's the pill or whether it's the injectable form. But some of the ones I think about, one is kind of a inconvenient thing is that feminizing hormones
Mm,
like spironolactone, estrogens, it looks like you can get slightly lower levels of PrEP in rectal tissue if you're on feminizing hormones. And some studies, although not all studies have shown that. So there's a worry that that combination could lead to a little bit lower protection from HIV infection. And so that's another reason why the injectable PrEP is good news. So if somebody was worried about that combination, they could get
mhm.
better coverage from the injectable PrEP. I'm still sort of waiting for a little bit more information about that though, because there are, how do you say this? It's sort of like a test tube study. Like people have looked to see if the level of the drug is lower in the tissues, and they've seen that in some studies. But does that really get in the way of protection from HIV?
Mhm.
The data on that are still rolling out, and it may turn out that it's not such a big deal. It may turn out it's a deal breaker. And so I want to get that information to my patients as soon as possible, and those studies are happening.
Awesome. Thank you for that. Thank you. Um, so next question up. Are there any pros or cons aside from like any like personal pros or cons? Are there any like um, medical clinical pros or cons to like taking pill forms versus taking injectable?
Yeah, so I think about every once in a while, there are medical issues that can get in the way of certain kinds of pill PrEP. The big one is kidney disease.
Mm,
So folks with kidney disease at a certain level, where the blood work suggests that the kidney is sort of below a certain level of function, probably can't take Truvada. Unfortunately, the Truvada can irritate the kidney, and also the metabolism of the drug is interfered with. There are other options, including Descovy is an option for some people, and also the injectable are an option. So kidney disease, I think of as something that's important for the doctor to check and to sort of talk about whether that affects the options. The other one, which is a less of a deal, is bone disease. It turns out that Truvada, we know from HIV treatment, can sometimes cause thinning of the bones. And it doesn't look like that's a big issue in the PrEP studies. But I figure if somebody's already walking in with thinning of the bones, I don't want to give them Truvada. I give them one of the other options.
Yeah. Okay. Now, I knew of an issue with like bone density being. I knew there was an issue with bone density, and a lot of these effects are somewhat latent, correct? Like down the line. Is there a time frame on them yet? Is there like if you take PrEP for this amount of time, if you take the HIV meds for this amount of time, here's what's going to happen so many years in the future? Is there a timeline on that yet?
Yeah, it's a great question. The timeline is slow. It's not like a precise number of years, but this was actually something that we did not even think about for years into HIV medications, and bone loss is not an issue with plenty of HIV drugs, but it looks like there's one specific piece of Truvada that is a bigger piece of it. We think that it was sort of this interesting pattern where HIV itself causes bone loss, sort of the immune system chasing after the virus can create inflammation that thins the bones. And so we thought it was all that for a long time, but then it turned out, wait a second, if you're on tenofovir, it's a piece of Truvada, looks like it's worse. And it only shows up after many years of being on it. And so that's good and that's bad.
Yeah.
So like if somebody has taken PrEP just for a particular short part of their life, and then let's say circumstances change and they don't really need it anymore, man, the likelihood that that's going to cause a problem is super low. But also that means that like years go by and then we need to start doing testing for thinning of the bones, a decade in, something like that. And most people don't have that problem, but every once in a while that happens. So it's a funky side effect that we kind of just have to be on the alert for.
Yeah.
And also that it's nice to have other options to avoid when we can.
Yeah. Okay. Thank you. So kind of shifting gears a little bit to more of the community side.
Yeah.
Recently I was in Puerto Rico for our United States Conference on HIV and AIDS, and Gilead presented, did an entire presentation about who's actually getting on PrEP and staying on PrEP.
Yeah.
Communities are doing so, and it's been seen that there are more individuals within the white community getting on PrEP.
Yep.
It's more individuals in the Black and Brown communities that are staying on PrEP. Is that something that you're seem to be ringing true? Like who's coming into your office asking to get on the medications?
Yeah, I think of this as it's a pattern that repeats itself all throughout HIV medicine and really in healthcare in general, that, we know there's injustice in our society and in healthcare, and that affects things like access to healthcare, ability to have somebody who treats you well, trust in healthcare. All of these things are in that space. And so we've seen this pattern repeatedly, that wealth and being white and being a man can make it easier to get access to the next greatest treatment. That's been true with HIV treatment, and it's been true with PrEP, and we could talk about stuff outside of HIV too, similar patterns. Also, we're finding that if you just make it possible so that people can get access to it, all people, regardless of their background, they'll take it. You know what I mean? Like, it's sort of an obvious thing, but it bears saying that there's not a biological difference between people based on skin color or whatever. It's about making it easy and making it possible and making it so that people can get the thing they need with respect. And so what we're finding is that if you make it so that Black and brown people or folks from other marginalized identities, trans people, can just get the thing they need from somebody who treats them well easily, they'll take it. And so trying to remove barriers, I think, is a big piece of the work. it's something that, in HIV programs, we know that it's not all about just scheduling something and writing a prescription. It's about trying to remove barriers, whether it's insurance as a barrier or stigma as a barrier or, whatever. And uh, uh, each new wave of new things that comes, it's like we have to say, well, let's figure out how to make that possible for everybody. And so I suspect since injectable PrEP is the latest thing to come, we have to be alert for that pattern. We're playing with it too.
What a wild concept, letting people get what they need.
Making it possible.
And making it as low barrier as possible. What a weird
Yeah.
concept.
Well, and Richard, I think one way we get there is that leaders like you say it. You know what I mean? Like we ask the questions, we keep on asking the questions until the answers get better, and we keep on persisting. It's not an us versus them. It's like, hey, we're human. We've seen this pattern. We got to work on it because it'll keep repeating until we force the issue.
Yeah, having the voices actually be heard is like one of the most prominent things in anything, especially in healthcare, because I know that I've faced so many issues, like being a Black person, being a queer person, and being a Black queer person in a medical setting. I always get like looked at sideways, like I don't know what I'm talking about. I don't know what I'm talking about. I don't know what's good for me. I should just be quiet and like listen to whatever medical provider is telling me. I shouldn't have any like agency in my own healthcare. But when in fact I do, people are surprised by the fact that how much not only myself knows, but my community knows about like how to like take care of themselves.
Amen.
Yeah, it's a wild thing. People being educated about the healthcare system and understanding their health.
Imagine that. And actually, I think what ends up happening out of that is, if you get people like you who are activated and know that they deserve to stand up and be heard and expect it and are savvy about sort of like, well, if I don't find it here, I'm going to find it over there.
Yeah.
Then that ends up being good for lots of people. Partly it instructs physicians and other clinicians who maybe weren't tuned into that as how it should be, to like, wow, that was great to have somebody who really advocates for themselves and expects a high level of care. And so I think, we've seen the culture of medicine change to be, better about that. And we have to just keep on pushing that until it gets to the way it should be. And so I appreciate the sort of the heavy lift of people who shouldn't have to do a heavy lift, but did it. And that's helping everybody.
Thank you. We're gonna slightly pivot again. So when it comes to PrEP and, well, let's stick with PrEP. When it comes to PrEP, the pill form is daily. The injectable is every 2 months. Are there any other kinds of regimens out there for PrEP?
Yeah, there are. So I think of there are 2 pills, each of which you can take daily, or there's injectable PrEP, which ultimately ends up being every 2 months. The injectable, I don't think I said this part, is that you start it, and then you take it after 1 month, and then you take it every 2 months.
Okay.
But there is one other schedule that's good to know about, and this is called on-demand PrEP, or sometimes people will call this 211.
Mm-hmm.
And this is only for certain people and only with Truvada so far, but I suspect we'll have more options in time. The idea is that for some people it works well to take either Truvada or Descovy every day. They just take it like a multivitamin, it's dialed in, and boom, they're done. And that level of shield from HIV is there.
Yeah.
But other people have come to their clinicians and said, look, that doesn't really exactly fit my lifestyle. So let's say if I am not in a relationship and I don't hook up very often at all, but I know that sometimes I do. Maybe I, to use a Vermont specific example, maybe I decide I'm going to take a road trip up to Montreal, and that weekend and that party, maybe there's a chance I'm going to hook up, and so I want a little protection for that. But
Yeah.
then I might go back to my quieter lifestyle and I might not hook up for a long time. So do I have to take something every day for that, just that one little thing? So it turns out there's a regimen called on-demand or 2-1-1 PrEP, where what you do is before a time of sort of like limited time period of exposure, you can take 2 pills the day before, 1 pill the day after that, 1 pill the day after that. And that works for, it's been studied in men who have sex with men and trans women to work just about as well as ordinary PrEP.
Okay.
But unfortunately, it has not been studied with Descovy, and it has not been studied in the context of injection drug use. And so I just don't have quite as much in the way of data to be able to say, oh yeah, for sure, you can take this. So so if it turns out that daily is kind of a bummer, and it turns out you have sex with men, particularly if anal sex is the transmission route, there are good data that 2-1-1 Truvada is an option for you if otherwise it's available.
Okay, thank you for that. Thank you. So I've explained the 2-1-1 method to people when like having like just like general conversations about PrEP, and it seems to like blow their minds. Well, there are several levels of people's mind being blown. There are still people that don't know PrEP is a thing, and when I tell them that it's a daily or once a day thing you could take to prevent HIV, that blows their mind.
Yeah.
When I have conversations with people that know about PrEP but not know about 2-1-1, and I tell them that there is this regimen that you don't have to take every day, but you can take intermittently, essentially, that blows their mind even more because we built up this idea of if you take PrEP daily, if you take PrEP and adhere to it, you're going to have the protection in your body. So that's what people are like sticking with in their mind. So like,
yeah, when
it comes to like this regimen, some people I feel like are going to be a little hesitant to actually believe it because it just seems like, oh, I can take essentially 4 pills, have a weekend, and possibly be okay.
Yeah.
And that's kind of like going against. It's alongside of and a little bit going against like what we've been telling people about PrEP when it comes to like taking your medication every day. So how would you respond to somebody that? How would you respond and or react to somebody who is a little bit hesitant about that regimen?
Yeah, I think it's a great question, and it's a question a lot of people have. This is an option for PrEP that is not used nearly as much as daily, partly because clinicians have the same hesitation. I think we've all sort of been trained that you got to take it every day or else it's not going to work.
Yeah.
And there's absolutely data to support that idea. So for instance, when you look in, there've been lots of studies of where daily PrEP was the expectation, but then you look at, well, let's look in the folks who really did take it daily versus folks who tried to take it daily but just didn't end up taking it that frequently. And you can see that the degree of protection does go down. So if you take 4 pills a week instead of 7, you have slightly lower protection. And if you take 2 pills a week instead of 7, you have a lot lower protection. And so I do think that that's a natural concern. And for me, it kind of gets down to the schedule of possible exposure to HIV infection. If it might happen any day of the week, sort of unpredictably, that exposure to HIV could occur, I think it makes the best exposure is to have an HIV drug in your system every day. But then whatever happens, whatever day it is, you have something that protects you from HIV. But I think not all lives are like that. And I think certain people can say it's going to be that Thanksgiving weekend and that, St. Patrick's Day where I might have the chance of getting HIV, and other days it's just not going to happen. And so let me target it. So I think it's important to have that sort of honest conversation with the prescriber about, well, what's life like, and really how do we match the right regimen to the right life.
Thank you for that. Um, kind of circling back a little bit to just treatment options. Um, I know this is mainly a conversation around like PrEP and like some with HIV treatment.
Mhm.
PEP is also a thing, post-exposure prophylaxis.
Yeah,
Can you give a little bit about what that is?
yeah. PEP, so post-exposure prophylaxis. So we've been talking about pre-exposure prophylaxis. You take Truvada or something else every day before exposure in hopes that therefore the exposure doesn't lead to infection. But actually, there's a good long track record of different kinds of post-exposure prophylaxis. So this can be for HIV and for other things. But it turns out that, if you're HIV negative and you are not on PrEP, but then you have sex, or there's a sexual assault, or in my line of work, if there's an occupational exposure, unexpected, it just happens. Then, if within the first 2 days you start a 1 month long everyday HIV regimen, that really drops the likelihood of acquiring HIV. So, if you get that treatment started right in that 1 to 2 day window after exposure, that also can help. And so, we've known that for a long time and prescribed HIV PEP for people. And I do think there's still a role for that. I think there are folks who, are not planning to be sexually active, or maybe they have a partner who they know does not have HIV infection, but then the unexpected happens. They have a partner who is HIV positive, or there's a sexual assault, and so they need something for that unexpected event. Still, HIV PEP is still there. Also, people have figured out, well, HIV ain't the only thing that can come up and cause exposure. And so what about other sexually transmitted infections?
Yes.
Could we have PEP for that too? And it turns out that's also something that we do. So, if one person contracts chlamydia or gonorrhea or syphilis, their known partners can also get treatment to avoid contracting it, or to kind of catch it early and make it so they can avoid symptoms. So, and we're broadening the scope of different kinds of PEP that you can get recently. So I think more options are coming around the corner soon.
And in reference to the PEP uh, around STIs,
Yeah.
sexually transmitted infections, that's doxypep, correct?
Yeah, so we've had this kind of general idea of doing PEP, and for years now, if somebody came in and said, "Oh, I got a call, and it turns out I've been exposed to gonorrhea or something," we would, do treatment related to that specific exposure.
Okay.
But it turns out that this new idea of doxypep it sort of like builds on that, but it's not exactly the same. So what if I, it turns out that I'm either maybe taking Truvada or something for HIV PrEP, but then I learn that, none of the HIV PrEP regimens are going to protect me from getting, most of the other sexually transmitted infections. But let's say if I learn that, oh, shoot, maybe somebody I had sex with a little bit ago has let me know that there's something, or I learned that it's out there. Is there something I could take? Or maybe I contracted
Mhm.
chlamydia or something. And then I'm sort of thinking, well, what about the future? What about next time? Is there a way I can stay safe? There
Yeah.
now have been studies looking at taking an antibiotic called doxycycline on a
Mhm.
regular basis to try to lower my likelihood of getting a sexually transmitted infection in the future. And it looks like it works. But unfortunately, it looks like it doesn't work for everybody, is the thing that we've just been learning this past year. But it turns out that for men who have sex with men, we've had some really good numbers looking at folks who had sexually transmitted an infection in the past, being about half as likely to get another sexually transmitted infection if they get on doxycycline. So not quite as good as HIV PrEP, but still, hey, if you take whatever the risk is of getting a sexually transmitted infection, cut it in half, that's good, right? We just learned in a conference in February, the retrovirus conference, that this did not work for women. They were put on doxycycline and really didn't see much difference at all. So we're still figuring out who really benefits from it. And so which person sort of has enough risk so it makes sense for them to invest in it, because doxycycline can cause side effects. And in which people do we need better options? So that's still sort of being sorted out right now.
So is that specifically for cisgender women or individuals with vaginas?
It looks like it was the folks who has been proven in are men who have sex with men and trans women who have sex with men. It looks like in them doxypep worked,
Okay.
but in all others we're still waiting for a good option out there. And so people are looking at, well, do we need like a different dose or a different antibiotic? And that, like PrEP, it'll come, but it looks like it's not going to be quite as easy as we hoped.
Okay. Thank you for that. Thank you for that. Two more things. We're winding down a little bit. So as far as like where to like get these treatments, be it PEP, be it PrEP, be it HIV treatments, where can people go?
Yeah, so a larger number of programs are using oral PrEP
Yes.
than injectable PrEP.
Mhm.
So for sure, the HIV clinics are doing PrEP. That includes the clinic at UVM. That includes the CVMC clinic. That includes the Veterans Administration, the VA, and an increasing number of LGBTQ friendly primary care practices are doing this.
Okay.
And honestly, I think this should be part of primary care. There's just no reason anybody who's at risk shouldn't have access to oral PrEP. It's easy. It's just a quick prescription that's safe to give. And so there are lots of educational efforts out there sort of trying to encourage this. But the honest truth is that some practices just don't have enough familiarity with it, so they just feel nervous about it. And so one thing that an activated patient can certainly do is advocate for that and get access. Like somebody like me can come and talk to a primary care practice and say, hey, this is easy. Let me teach you how to do it and help spread the love. Injectable PrEP is a little bit tougher to give. There's just more stupid insurance approvals to get through. You got to have it on site and you got to be able to know how to administer it. So right now, that's the UVM HIV program and the VA are the ones that are giving injectable cabotegravir. But in time, more people will do it.
Okay.
It would be great if like Planned Parenthood and others can
Yeah.
get in that game, and I think that'll happen.
Hopefully it will. And I guess the last question up, how much are these things? Like, what's the cost? Like, what's the cost with insurance, without insurance? Are these things even covered under like things like Medicaid? Are they covered under private insurance, work insurance?
Yeah, so this is a little bit of an evolving thing. So most insurance plans do cover oral PrEP now. We went through a period where it was pretty tough to get that cover, but now it's becoming increasingly common. And the hard part is, every insurance company is a little bit different. They all have their quirks. So the trick is to, do the prescription, get the pharmacy to give a real readout on how it works. And so one thing the incredible pharmacy and case management staff in our clinic do is sort of help my clients sort of look into that and see what it's about. Even if the insurance won't cover it, or if somebody does not have health insurance, the drug companies have these rebate programs that can help out. So it's really common for us to be able to get folks on oral PrEP. Since injectable PrEP is newer, the insurance coverage for it is still evolving. Most commercial insurances will cover it, and and so that's been a huge boon for it. It turns out that in terms of government and coverage for it, that Medicaid will cover it, but Medicare does not. But also there's a rebate program for that. So what our experience has been is that somebody comes in and says, like, I'd really like to try cabotegravir for injectable PrEP. And we do, let's throw that in the insurance supercomputer, see what the numbers look like, get you all set with some labs and some screening stuff. And by the time the answers are back on the screening labs and and we kind of get all that stuff sorted out, we can get a read on what insurance is possible. If that person needs to go to the rebate program, we help them out, and eventually we can get you started. But there's some hoops to jump through, but it's still possible.
Okay. Awesome. Thank you. Thank you for that.
Super boring to have to think through this stuff, and this is exactly why not everybody gets easy access to it. So
Yeah.
one of these days we're going to get to a place where everybody has got health insurance and you just show up and you're like, I need this, can I have that? Boom. But not in 2023 yet.
Not yet. Hopefully soon. Hopefully very soon.
Amen.
And I feel like past all the like issues with possible like side effects, adherence to the medications, getting to like the actual provider, I feel like payment is like always going to be like the biggest barrier for anybody trying to get into anything.
Yeah.
And that's the unfortunate side, because if things were made very, very, very low cost or zero cost, we would have a lot more individuals in these programs on these medications that are essentially life-saving and or preventative.
True story.
So it astounds me that like anytime I've had like an issue with like my assistance program, like seeing the amount that I would have to pay if I wasn't like a part of the program, it's shocking.
It's
Like,
shocking.
it's shocking. Somebody recently, one of my friends recently had an issue like with their like losing insurance through their parents and like not being able to like be a part of the AIDS drug assistance program, and their bill came up $3,000 some odd dollars for a prescription, just a one prescription, and that's just like that's mind blowing. Something
Yeah,
that
honestly, like that's a piece of the counseling that we do in our clinic. Like, we're going to have to run this through the pharmacy so we know what the deal is with the insurance plan, and don't freak out when you see that number, because like we've got tricks, we can do this, but like, yeah, you see those numbers and you're like, who can pay for that? And it's ridiculous.
and we know there are some people who can like pay for it out of pocket, and good on them for being able to do so.
Yeah, that's great.
That's not everybody's deal though.
That's not most people. Yeah, that's right. You know, Richard, I realized that there's one just quick little detail I should just mention for folks who like the details. One thing just to know about with injectable PrEP that you alluded to a little bit, which is, you know, we're used to saying you got to take your HIV treatment every day for it to work and for resistance not to show up. And we think that with PrEP, though, but we've had sort of a similar thought, whereas it looks like resistance on PrEP is not a super common thing. But one thing we are learning is that the injectable PrEP is great because it lasts in the body for a long time. And that's why you can take it for 2 months. But you can imagine if somebody takes an injectable PrEP and then they stop taking it, it's going to take a long time to sort of get out of their body. And in that period of time, they call it the tail period, where the medicine's getting out of the body, resistance can show up. So one thing just to know for folks who are thinking about injectable stuff is that if you're thinking about going off, the best thing is to take oral PrEP for a couple months right at the end if you're still going to be at risk for going off of the injectable. So the program can kind of walk people through the details of that, but it's just something to have in the back of the mind.
Awesome. Thank you for that. Thank you. I think we're at the end. I think that's all I had. I think that's all the community had. Is there are there any final words, Dr. Leahy, that you want to throw out there as far as like PrEP, HIV treatment, PEP, just in general healthcare nonsense? Anything you want to throw out there?
You know, I mean, I think maybe I'll start in the same place that I began, with gratitude. You know, I feel lucky to work with people with HIV and people who care for people with HIV, because it's a model that we all should emulate. That this is a partnership, and that people are educating each other and advocating for what's right together. And that's how it should be in all different fields. And that's increasingly becoming true. And that gives me optimism that sure, HIV can come along, or COVID or Mpox or whatever it is, and it can be tough, but we can face it if we do it together. So I feel grateful to be on that team.
Awesome. Thank you. Thank you, everybody, for coming to this lovely little talk about some PrEP updates as well as some HIV treatment updates. Dr. Leahy, if individuals want to contact you directly, how will they be able to do that? If they can contact you directly?
Probably the best thing is to reach out through the HIV clinic. I'm happy to see people. And so, yeah, reach out and if somebody's new to the HIV clinic, we'll get them in quickly. And if they're old hat but just have new questions, same thing. So that's probably the easiest thing to reach out.
Awesome, thank you. I just want to let everybody know if you ever want to get a rapid HIV test, you can always see me here at Pride Center. We are doing HIV testing Wednesdays from 4 p.m. to 8 p.m. It's free, 20 minutes. It's confidential. Whatever we talk about stays between you, me, and the walls. So yeah, if you ever want to get tested for whatever reason, come down and see me, or we can make an appointment by going to testing at pridecentervt.org, sending an email to testing@pridecentervt.org to set up an appointment. Once again, thank you, Dr. Leahy, for coming on. I appreciate it. It was good seeing you again, good having a conversation with you.
Likewise, and thanks for your leadership.
Not a problem. Thank you. All right, everyone. Enjoy the rest of your day. Be safe. I would say stay warm, stay cool. It's getting warmer out.
Stay medium cold.
All right, everybody. Thank you.